I noticed during the presentation sa budget utilization, you have a budget Bayanihan 1, Bayanihan 2, the GAA. For COVID response is roughly 660 billion. Okay? Ang na-disburse dito, mga 480 billion. Okay? So, hindi pa na-disburse lahat. Okay? Now, having said that, yung lahat ba ng benepisyo na linagay natin sa Bayanihan 1, Bayanihan 2, GAA, halimbawa, for the health workers, katulad ng special risk allowance, active hazard duty pay, meal, transportation, accommodation, insurance, death benefits, etc. Naibibigay ba lahat ito sa ating mga health workers?
Mr. President,
Yes.
Mr. President, Your Honor, meron ho tayong gap. That's why we are asking for a supplemental budget under Bayanihan 3. Kung magkakaroon po, kung maipapasa po yan, kasi nga kailangan natin ng 51,615,887,624 pesos. Ito po kasama yung 365,000 health workers, yung kanilang actual active hazard duty pay. Yan po. At SRA na 300,000 na katao, accommodation, transportation, meals, insurance. Ang total po na kakailanganin dito, 25 billion. Tapos ang hospital MOOE augmentation, kailangan din po ng 10 billion. At ang emergency hiring for the pandemic response, 11,000, which will require 2.5 billion, and then 5,517 vaccinators and 15,266 screeners for a required budget of 6.6 billion. So ito po yung kakailanganin natin to address the gap in the pandemic response. Salamat po, Mr. President.
How much is the total again, Secretary?
Sa 51,615,887,624.
Okay.
Ang
so
total po,
yes.
Ang total po na kailangan, sorry sir.
Yeah, yung 51 billion na binanggit mo, utang natin yan sa health workers natin. Is that correct?
For July to December lang po ito, Your Honor.
Yes. Okay. Okay. So sa ngayon, hindi pa rin natin nababayaran ng gusto yung ating mga health workers. At kukulangin pa tayo ng 51 billion na nabanggit ninyo. Is that correct?
Yes, that is correct, Your Honor.
Okay. And then may nabanggit pa kayo. So can you repeat the others? Magkano yung kulang? So 51 billion and then you had something in addition.
Tama po kayo. Dito po sa health promotion for vaccination campaign for 17,667 social mobilizers. This is 1,741,000,000 thereabouts. And then for isolation, 267,999,882. Bureau of Quarantine requirement would be about 100 million. And arrears, may arrears po tayo. Bayad sa World Trade Center as a temporary treatment and monitoring facility at 95 million. So sa detection naman ay itong item nito kinakailangan pa rin natin 11 billion for testing requirement, remainder for surveillance. So a total of 66 billion thereabouts to constitute 100%. This is the gap that we need from July to December, Your Honor.
Okay. So if we were to pass a Bayanihan 3, the first order of the day is to fund that 66 billion. Is that correct?
That is right, Mr. President, Your Honor.
Okay. Does that also include already all the protection needed by our health workers? Halimbawa, mga PPE.
Yes, Your Honor.
Okay. And you are also saying that we may not be able to vaccinate all the entire adult population if we do not fund these programs. Is that correct? That's part of the vaccination program, part of our response to the entire pandemic problem. Is that correct?
Well, The vaccinators, meron po tayong naka-budget dito na 5,517 vaccinators and 15,266 screeners. That will require a 6.6 billion budget, Your Honor.
Okay.
Mr.
In
President,
relation to
can I
vaccination.
intercede, Mr. President?
With the permission of Senator Recto, Senator Villar is recognized.
I just want to manifest that in our city, Las Piñas, yung wala namang, hindi naman kailangan ng hospital namin ang mga ganyang worker kasi tumutulong na yung local, tumutulong na yung barangay, at tumutulong na yung private sector. So kami, tinutulungan na namin yung DOH-operated hospital. Yung mga private, like si former Senator Villar, siya na nagsusweldo ng mga nagbabaksinate para dumami yung mabaksinate. And then, yung barangay namin, sila na talaga ang tumutulong para in fact, with our target, baka makaabot na kami ng matapos namin ng vaccination by September with the experience, the number of people vaccinated. Kaya medyo hindi natin masyado dapat inaasa lahat sa DOH. Hindi naman talagang kailangan maraming tumutulong. Yun lang po. Gusto ko lang ipahatid sa inyo na maraming tumutulong at makukuha natin ang target without that much money from DOH.
Thank you, Senator Villar. Would you like to respond, Secretary Duque?
Thank you, Your Honor, Mr. President. Ito pong halaga na ito, yung 5,517 vaccinators, nurses, midwives, pharmacies, need to be hired 50% of the human resource requirement at 12,266 health screeners para po talagang mas matutukan itong ating bakunahan. Pero pasuin pa rin namin ito, Mr. President, para talagang malaman natin yung saktong kakulangan sa ating pong human resource. Dahil ang sinasabi po sa akin ng aking USEC sa likod ay yan pong mga trabaho din ng mga nurses at mga vaccinators o mga human resource complement, baka kasi maapektuhan din yung kanilang trabaho sa pangangalaga ng mga non-COVID patients. So ito lang po
That's
yung medyo pinaghahandaan natin dahil syempre yung mga iba po ay talagang kinakailangan po na magpahinga din naman kasi this will be on top of the regular hospital work, Your Honor, and it might compromise the quality of service in the hospitals for even the non-COVID patients. Salamat po, Mr. President, Your
Thank you.
Honor.
Senator Recto, you may continue.
Yes, thank you, Mr. President. Thank you for the response, Secretary. And I understand that nakakailanganin natin ng dagdag na human resources dahil nga ang target natin 700,000 a day ang dapat natin ma-vaccinate. And today, the average is only about 75,000 a day. Now, having said that, also, binanggit ko rin to because maraming umaabot na reklamo sa atin na yung mga benepisyo linagay natin sa batas, sa Bayanihan 1, Bayanihan 2, at sa GAA ay hindi nakakaabot dun sa mga frontliner natin na alam natin pagod na at tuloy-tuloy yung trabaho nila. So I thank the Secretary for pointing all this out, yung budgetary requirement na posibleng kailanganin. At kung magpapasa tayo ng Bayanihan 3, ito yung pinakamahalaga to begin with, Mr. President. Now, you cannot solve the economic problem unless we solve the health problem too, as well, no, Mr. President?